It's very much back of house staff that get unnoticed and unrecognised, but they're fundamentally the core backbone of the service.
It's what we do in the background helps keep the doctors and nurses in the foreground running.
From porters and cleaners to maintenance technicians and gardeners, our estates and facilities teams are the backbone of our hospitals, ensuring our sites can function and our clinicians can provide care to our patients. So I was really pleased last month when we had the opportunity to celebrate their work as part of National Healthcare Estates and Facilities Day. Today we'll hear from Head of Estates Maintenance Neil Harvey and some of his Estates and Facilities colleagues about the crucial work that they do here at the Trust.
We deliver a 24/7 service. It's very much back of house staff that get unnoticed and unrecognised, but they're fundamentally the core backbone of the service. Estates is around maintenance. That maintenance is obviously the operational maintenance. We have maintenance workers, maintenance assistants, grounds and gardens teams, painters and decorators, joiners, going into the capital team, covering all aspects of the construction design and management regulations. Then all the way through to the business management team. They focus around policies and procedures.
Facilities covers a wide range of areas. You've got the cleaning team, you've got the porters, you've got the catering and ward hospitality staff, you've got things such as even linen and accommodation staff, which is all covered by facilities.
I think the biggest challenges that we're faced, I think, is the age and obviously deterioration of buildings. 50% of BRI was built pre-1930s. St Luke's were built Queen Victorian age.
It's a very old building. Sometimes we get stuff where I'm not familiar what's been there for years. But lucky enough, we've got lads here who've many years of experience doing plumbing and that, so you kind of have that teaching as well there.
Now the decontamination building, when it was built as part of the heritage and listed buildings aspects, one of the stipulations with that is that it had to be completely different. And obviously you can see with the iridescent cladding, it completely gives a brand new outlook. And that was just one of the challenges that we have to overcome. In terms of emergency works, the one sort of springs into my mind that we had a power failure on the nucleus block. All the power of the essential side was completely lost. Now that served nucleus theatres, HTU departments and clinical engineering. What we ended up having to do was bypass various electrical services. We were then able to manage and instigate the fault, rectify that. That was a massive relief because we were able to obviously provide supplies to patients that were obviously in desperate need of it. At the point of reinstating, Mel actually came round the corner and started asking questions as well. And having that communication and dialogue with the chief exec, it was quite reassuring and helpful as well. The Estates and Facilities Healthcare Day allows us to celebrate, showcase and thank all of the Estates and Facilities colleagues working across the NHS, delivering the best care possible in hospitals. One of the biggest things what we've tried working on as an Estates and Facilities department is collectively working together as a team.
So in facilities, a porter would do about 25,000 steps a day. Cleaning could do about 150 areas a day as well, and our catering staff do 850 menus and meals sent to the wards a day. So they're always busy and always making sure that the hospital flows as smoothly as it can in the background.
I think the best part of my job is being able to deliver a core service that is for the benefits of patients.
It's all about patient quality, it's all about patient care as well. Being local, you feel like you can interact with them better, give them a better experience, but also you don't want to feel like you're in their way. If we do our job correctly and we can do it to a good quality standard within the time frame, it makes their time here better, and it also makes our time better as well, because we know that we're helping vulnerable people.
When you see patients coming out and they have a little chat to you, quite often they just come up and ask, what's these? Where would best place would you get plants? You can see them walk off with a little smile looking at the work you've done. You've took that little couple of minutes out of your time just to chat to them, because they might have no one.
Favourite part of the job, I'd say, would be the people that I work with. Because we're in the background, people don't think about it all that much, but we are all like one big hospital team. It's what we do in the background helps keep the doctors and nurses in the foreground running, and that way we can all work together and ensure better care for everybody.